So, welcome to everybody on RN Talks platform once again. Today, we celebrate the World Oral Health Day. Oral Health Day माने आपकी दांतों की hygiene and oral health से related है. So, without wasting much time, I would like to invite today a practicing dentist from United Kingdom, London, Dr. Aparna Nath Vasudeva, to enlighten us about the basic dental care that we often ignore in our daily lives. क्या होता है कि जब हम लोग बच्चे हमारे खाना खाते हैं या कुछ भी करते हैं तो हम लोग उनकी ओरल हाइजीन पे इतना ज्यादा ध्यान नहीं देते हैं जो कि हमें देना चाहिए और जब हम वो नहीं देते तो उनके दांत कई बार खराब हो जाते हैं और हमें डॉक्टर्स के पास डेंटिस्ट के पास जाना पड़ता है सो इंक्लूडिंग मी नॉट वेरी मेनी पीपल लाइक द डेंटिस्ट चेयर सो डरिएगा मत आपके पास डॉक्टर अपर्णा नाथ आ रहे हैं अपर्णा नाथ वासुदेवा शी इज अ प्रैक्टिसिंग डेंटिस्ट एंड शी इज बीन प्रैक्टिसिंग इन यूके एंड मैं उन्हीं को लेकर आ रही हूँ एंड वील आस्क सर्टेन क्वेश्चंस दैट विल हेल्प enlighten you all as to how to take care of your child and yourselves for oral hygiene. So, welcome on the show, Dr. Vasudeva. Uh, how are you? First, tell me, today is World Health Oral Health Day. So, how is everything at your end over there?
Well, everything is fine. I think in the lockdown, everybody has been eating a lot of sweets, and that has made us busier.
I
Uh,
know.
uh, um, but it's also a time where people have more time. So, these are the time to form habits. Uh, and I think whatever habits are made in as a child will continue into adulthood. So, it's when we have all the time, then it's nice to be able to form a routine.
First of all, I'll start with like since you mentioned COVID, how difficult means were you treating patients during COVID and कैसे करते थे आप ये माने कोविड में तो डेंटिस्ट एज अ डेंटिस्ट सबके मुंह के अंदर घुसना होता है लिटरली एंड मास्क लगाना एंड कोविड इज लाइक ब्रीदिंग से ही मींस ट्रांसमिट होती है सो हाउ डिफिकल्ट व्हाट चैलेंजेस डिड यू फेस कोविड में विद आप कैसे करते थे इसको ट्रीट
Well, I think first 3 months in England, at least, they shut down everything. So we were also not seeing patients face to face. But हम टेलीफोन consultation provide कर रहे थे. So the patients would call us, and we had to relearn how to do dentistry. Really, जहाँ पे जब patient आते थे, we could just pick up a drill and do what we did. We had to kind of help them and tell them what they could do themselves.
राइट
And then there were some areas where we could send them, but well, that was not easy because you just wanted to be there and help the patient, but you
राइट
were not allowed to. The government had shut down everything, including dentist. But so that was hard, trying to
reach out help out and then
out
again
in extreme pain. But now, and we have quite a few standard operating procedures and lots of PPE, everything in hand. So there are these procedures which we follow, and we've all been vaccinated. So
So
it's
now
much.
things are basically not, I wouldn't say absolutely normal, but much more stabilized than it
Yes.
was during that time.
Yes, because we've learned how to deal with it. We're just not doing things the way it was done before. There are less number of patients we see. We prioritize patients. So, and it's not a full packed waiting room. It's not one in and one out. There's a lot of time between patients, so there's more thorough sterilizations. There's more PPE. So we have learned now. Uh,
Everybody had to relearn everything in I think, a new way, including the dentists, and of course, all professions went to a new through a new you.
yeah, but as dentists, we've always been very, very high in. I think dentists, a dental office is the cleanest place you'll find. It's like an operating theater. So we've always been very high on cross infection. So it was not something new for us, cross infection, because we've always what we have been doing for ages. We have just doing more of that. So I think really dental office is one of the cleanest places you will find.
True. It whenever like I go to a dental center, it's always like kind of like that disinfectant is overpowering. So that's enough to scare me, as if the dental chair wasn't enough. Besides all that, what I would like you today, Dr. Vasudeva, is to cover like हमारे यहाँ पे बहुत सारे बच्चे ब्रश नहीं करते हैं, सो जाते हैं, बहुत मीठा खाते हैं, they're always into like sweet, and parents are not taking care, and बहुत सारे endorsements भी आती हैं. So basically, without going into any advertising or anything, I just want to know, is there a particular type of toothbrush, like soft, medium, hard kinds, or toothpaste that is basically normally best in all circumstances, for which it suit normally everybody?
Well, it is. I would say there's a few things which are very important in child's hygiene. First thing is diet. So you can't just brush and be eating, sugar attack all the time. So diet is the most important thing in a child. And toothbrush, if it's a small headed toothbrush, any small headed toothbrush, because the child's mouth is small, the smaller the size of the tooth, the head of the toothbrush, they'll be able to reach right at the back of the teeth.
And what
So
about the adults?
for adults also, I would say a small head. So I would very, very highly recommend electric toothbrush.
Okay.
If someone has not used an electric toothbrush, if they use it, you cannot go back to a manual one. It's just as simple as that. The kind of cleaning you get in electric toothbrush, you it's just I don't think you can go back to a manual one once you start using an electric one. So you know whatever brand you fancy, whatever brand, I mean, is
Available.
available, or whatever is more economic for you. But I would say get into an electric toothbrush. And most electric toothbrushes have a small head, which will help you go clean all the back
And
surfaces.
reach up to the last molar, I think.
Yes.
Right. Do you really need to floss? Because floss is a concept that I had learned at my dentist, but not very many people are accustomed to floss. I think बहुत सारे लोगों ने floss के बारे में सुना भी नहीं होगा, that there is a floss kind of a thing. For those people who don't know, you can just look up Google what is floss, and it comes in a small box. It's a nylon thread kind of a thing which is disinfected, and with which you clean your teeth. So, Dr. Vasudeva, do you really think that flossing is, I think, needed or necessary or a part of dental hygiene? And how often should one floss?
I think, like I said, all these habits start in childhood. That's why, it's very important. First, get to the basics of brushing twice daily, once in the morning, once at night. And flossing, any kind of interdental cleaning is important. And when you are looking at a floss, you have to go for a very high quality floss, because if you buy one of these cheap flosses, they don't help. It's like saying, when you are brushing, a teeth has six surfaces. So with the toothbrush you can reach the front and the back of the tooth, but in between the teeth, where most of the cavities will form.
Right.
Where the your toothbrush is not going to reach there. So how do you clean that surface? The only way you can clean that surface is with something interdental. So it can be a dental floss, or it can be a interdental, small interdental brush, which will go in between like a little bottle brush. But you need to clean in between the teeth. So some people will have very tight contacts, and
Mm-hmm.
they might be able to get away without flossing. But especially as we get older, our teeth wear down and more gaps can appear between. Then it is very important to clean between those two surfaces of the teeth so that you don't get decay. Because any area really where, if your food is getting stuck there, that means there's a problem out there. So you must clean there with an interdental brush or a floss. And if it is consistently गेटिंग स्टक, अगर बार बार आपका खाना वहां कहीं पे फंस रहा है, वहां पे कोई प्रॉब्लम है, आपको अपने डेंटिस्ट से मिलना चाहिए एंड चेक करवाना चाहिए.
Right. Like, I have seen lots of mouthwashes in the market. मेरी माउथ वॉश लेने जाओ, बहुत सारे मिलते हैं. तो माउथ वॉश शुड वी फॉलो माउथ वॉश आफ्टर प्रॉपर ब्रशिंग, or can we do it intermediately between meals, or it's not needed at all, or does it help?
Well, mouthwash is an adjunct. It should not be instead of brushing. That is one thing I would say very importantly. You can use it, you don't have to use it, but the main way we remove plaque and everything, clean a mouth, is the mechanical cleaning. So the mechanical cleaning is by a toothbrush and a dental floss or an interdental brush. Over and over above that, if you want to use mouthwash, kind of gives a good feel good factor to the patient, and it's a chemical cleanser. So that
And
can be.
like a mouth freshener also, I think.
Yeah, so it's in addition to toothbrushing or tooth, but it's not, in as a alternative. Some people would brush their teeth in the morning, but will just use a mouthwash at night. That's not acceptable. You have to brush your teeth twice daily, but if you want to use a mouthwash, you can. There is a place for mouthwashes, but do not do it after brushing, because then you are washing away all the good things of the toothpaste, which has fluoride, which is very important for your teeth. So all the good things of the toothpaste, in fact, we don't we tell our patients not even to rinse their mouth after brushing. So brush your teeth and spit it out, not
Oh,
even your mouth, because what happens is when you brush your teeth and spit it out, you get a coating of that toothpaste in your mouth, which has got all the good things in your mouth. So, and then you can use the mouthwash in between meals. So, after you've had a snack in the middle of the day or after lunch where you can't brush your teeth, that time the mouthwash is okay. But not straight after brushing. So, not in the morning and night when you've brushed your teeth, but in between meals and after a snack or something like that.
okay. Like over here, lots of toothpastes that I have seen, they say कि हमारे सॉल्ट में नमक है, हमारे सॉल्ट में माने टूथपेस्ट में नमक है, टूथपेस्ट में फ्लोराइड है. So salt and fluoride, as from not from an advertiser's point of view, aren't they naturally present in water also? Do we, or we need a little bit extra in our toothpastes?
Well, every country is different and every area is different. So I know in the UK we don't have fluoride in the water. I'm not sure what it is in India. Fluoride has been, some areas will have a higher fluoride. If you've got a high fluoride already in the water, then
Need a
need
fluoride
you don't
toothpaste.
need extra fluoride, but the amount of fluoride which is in the toothpaste is not harmful, and we are not ingesting it, we are just putting it on the toothpaste and we are spitting it out.
So
So
it's
it's fine. uh, Fluoride does help, has a big plus part to play in dental, helping reduce dental decay. So we do like fluoride, but excess of everything is bad. So it just depends on how much fluoride is in the water, wherever you are. So I can't comment on the level of fluoride which is in, but you will need to check your own uh,
Water and the with the
the
local authorities.
authorities and find out what fluoride level is there. But if you're using your,
Otherwise, it is safe.
otherwise it's safe. You don't have to use tablets or anything extra. But whatever
Right,
is in this will not harm you anyway because you're not ingesting it.
right. Okay, Dr. Vasudeva, can you tell me a little about dental X-rays? Like, हमारे तो when we go for X-rays, certain people say like ladies in pregnancy should not go for a X-ray, or lactating mothers or young girls should not be going in for X-rays. So, is it the same case with dental scenario also, or dental X-rays for anybody and everybody is basically safe?
Well, the amount of radiation in x-rays is in dental x-rays is very, very minute. uh, Having said that, any x-rays is an x-ray. It's obviously it's harmful for you, so you will not do an x-ray if it's not required. So there should be an indication for an x-ray. And if somebody is a higher caries risk and routine x-rays are taken, that's the risk is very, very tiny, but there has to be a justification for an x-ray you take. uh, but they have a very they're very highly diagnostic. So there are a lot of things you cannot find without a x-ray. So it really depends on the clinical needs of the patient. But there definitely is a place for x-rays, and we are taking them quite routinely here in the UK. But we need to justify every x-ray we take.
Right. So, like fillings, some people say there's temporary fillings. Some people go for amalgam, those silver fillings. Some people go for those white fillings. I don't know, whatever you call them, that resemble the natural teeth. So, basically, just asking. See, these are cosmetic things. So, if you go for, but the life of the both the fillings, is it same like amalgam or the ceramic filling? Is the life duration of both same, or it depends on what you eat, or one is a little more durable but doesn't look so beautiful, but is durable more like amalgam? So what's your take on this?
Again, I would say that we you have to judge every case by its clinical need. So in some cases amalgam will be perfectly fine, uh, and in other cases a white one will be more suitable. So there is obviously a big talk about mercury being an amalgam, and lots of people are moving away from it. But it is a filling which has been done for almost 200, 300 years, and it works quite well. So I would say you trust your dentist and go for I mean, there some places amalgam is absolutely fine. I was just talking to my mother today, and she was showing me that, oh, this is the filling you did for me 25 years ago and it's still there. And I do see a lot of amalgam filling in my patients who are elderly patients. They have been fine for 30, 40 years. But there's a lot of talk of but the white fillings, the new generation white fillings are excellent as well. So it really depends on the clinical need of the tooth. And
I think what depends upon is how near to your smiling range is your tooth. So
of course, filling in your front of your mouth, of course, isn't it? So
uh,
it might be absolutely fine in the back of your teeth. So I think,
again, it depends, I think,
yes,
from person to person and from the case that comes in on how strong the filling is needed and where it
where
exactly
it is
is
required. Yeah.
located. Right. So there are certain people, who have yellow teeth. बहुत लोगों के दांत बिल्कुल पीले हो जाते हैं. So they want to, like, whiten up their teeth, especially शादियों का सीजन जब आता है, सबको वो बिना का स्माइल चाहिए, और पीले दांत किसी के स्पाउस को पसंद नहीं है कि मुंह खोलो और ऊँट के जैसे पीले दांत दिखे. सो हर कोई अपने दांत सफेद करवाना चाहता है. सो नंबर वन, इज इट सेफ? And number two, I would like to ask you, is it a very complicated procedure, or what do you as a dentist recommend the way to brighten your teeth, or like, whiten your teeth?
There are a lot of things which can be done nowadays. I would just say, don't just go, just go to a qualified person. Don't go to a beautician who would just use funny bleach on your teeth. Go to somebody qualified. Who knows what they're doing, because these things are chemicals, so you can use things like bleaching to your teeth, but it has to be done by a qualified professional. If you just buy something from Amazon and use it, you can just be in.
No self medication and no self bleach.
Yes,
You
so
need to spend money to
you need,
go to a professional.
yeah,
And
who can
yeah,
uh, in a controlled environment, rather than doing something which will just uh, can because you might have decay in your teeth, and you might put bleach on top of it, and then you might end up needing something, and shooting pain, which you wouldn't have if somebody would have checked you, because you can't do these things on you need to do, if you have to do something, it has to be in healthy teeth. If you have
right,
to, the first is health, and then comes cosmetic. You cannot whiten unhealthy teeth. If you start, you might not be having any pain, but you don't know what's lingering on till the time you've seen a dentist. So, till the time they've taken an x-rays, because even if you just have a normal checkup sometimes, even if a dentist sees, you can miss things if sometimes your x-rays are not taken. So all these things are quite important. So before you start going into cosmetic treatment, it is most important the health is health, it's healthy.
you have to check your teeth basically, so that you don't have any pinhole cavities, or maybe a rotting tooth inside that is not visible from outside. And
Yes,
one more thing, what you just said reminded me of what my mother always used to say: penny wise pound foolish. मैंने चार आने बचाने के लिए आप अपने ऊपर रुपया खर्चा कर देंगे फिर डॉक्टर के पास भाग के, and you'll eventually land up more sick than you actually were. So it's
yes.
better to do it. You want to do it, fine, but I think the way you said it, take professional help, get everything checked up, whether your teeth are perfectly fine, to get some chemical onto it. And if it's fine, then well and good, go ahead with it
Yeah, yeah. It has to be health first and cosmetics later.
later.
Yeah, I think that is the key. You can do any cosmetic things on a healthy tooth, but you can't do it on decayed teeth. And dental decay is like, I would say, sometimes I would describe it like a rot of an apple. If you have seen एक सेब देखा, उसमें छोटा सा होल है, and you cut it, and then you see it's all अंदर से खोखला है. Okay, so dental decay is exactly like that. It can be a very small hole, but when you go in, it's just spread everywhere, and you have to just scoop it out and then fill it. And by the time you scoop it out, it might be into the nerve. So that is why X-rays are so important, to see the extent of. You might see, oh, this. I hear people say that sometimes. Oh, I had this filling done. It was so small, but my dentist drilled it and it became so big. But that was because there was decay which you could not see. You could see the small hole, but couldn't see the decay, which, like, if you, like I said, it's like a rot of an apple. It's a small hole on the top, but it's just decaying inside. So, which, if you don't remove that decay, it will not stop. All that decay has to be removed for it to arrest itself.
Right. Now, will be just closing about few more questions to you. Like so many children, like they have got their tooth, like थोड़ा आगे पीछे होते हैं किसी के दांत. So if your teeth are not aligned properly, that automatically impacts your smile. So for teeth and the smile, generally people have to go in for braces. So, what is an optimum age when a parent, as a parent, कि बच्चे को ब्रेसेस लगाने चाहिए, किस एज से पेरेंट को सोचना चाहिए एंड डॉक्टर की हेल्प लेनी चाहिए कि मीन्स तकरीबन किस एज से ब्रेसेस लग सकते हैं? बिकॉज एक बार अगर तो दांत टेढ़े मेढ़े हैं या आगे पीछे है तो ब्रेसेस तो लगाना ही है, पर कभी कभी क्या होता है टीन एज के बाद लगाते हैं, ये बच्चा कॉलेज में आ जाता है, देन इट बिकम्स वेरी एम्बैरेसिंग फॉर द चाइल्ड। सो ऐसी द ऑप्टिमम एज व्हेन कि लग जाए और बच्चा बड़ा होते होते वो ठीक भी हो जाए, उसके माने सोशल लाइफ पे कोई प्रेशर भी ना पड़े। सो व्हाट इज द ऑप्टिमम एज व्हेन जनरली इट शुड बी डन?
It's usually when the child is undergoing puberty. So I would say between after the age of 10, is the time where you should as if there's a quite a wide there's no harm in taking an assessment earlier. In fact, when they're going for general checkups in the UK, they say the moment the first teeth come out, you take your child to the dentist. So that is at the age of 6 months, you start taking your child to the dentist for a checkup, and then they come to us every 6 months, and we keep assessing them. But usually by the time they are going into secondary school, so 10, 11, 12, and they're going through a growth spurt. They're losing their milk teeth and they're getting all the whole set of permanent teeth. Is the time where it's the jaws are also growing, so the dentist can actually use that growth spurt along with the with the way the jaw is changing to you know
Fix
you
the teeth and realign them basically.
yeah. So definitely by the age 11, 12, you should have at least taken an assessment and
As
seen it.
dentist is, I think.
But they should be going every 6 months, so the dentist will automatically pick it up.
Yeah, and then he'll tell you ki when your child is ready or when his teeth are ready to go in for alignment, then he can set it up.
Exactly. So by the time they've lost their baby teeth, they've already got into their, they've already got the functional appliance and things in place.
So one last question to you. Uh, like everybody, like including me, I just love sweets. Okay, chocolates. I think itna advertisement hota hai, itna hype hota hai, chocolates and sweets. And with Holi coming on, festivals, India is like always full of festivals. One goes, the other comes. One goes, the other comes. And for every festival, we have different sweets. किसी में गुजिया बन रही है तो किसी में अलग अलग चीज है, किसी में खीर बन रही है तो किसी में घेवर बन रहा है। तो बेसिकली should we actually go around avoiding sweets and eyes like candies, or are they so bad for teeth, or we can have them while keeping the oral hygiene basically?
Yeah, India and sweets. uh, so yeah, you can't run away from it, isn't it? So I think the best thing is to limit it to meal times. Okay, so if you खाने के बाद आपको मीठा खाने का थोड़ा सा मन करता है, then you have a little bit, but then rinse your mouth afterwards. You should not have a constant sugar attack. Okay, so because that reduces the pH of your teeth. So you want to have a little sweet, you try and limit it to meal time, so you have it after food, but then rinse your mouth or brush your teeth afterwards. After that, don't have anything again. And don't, the worst thing I would say is a lollipop, because the child just sits and keeps on sucking on and sucking and sucking on it, or these sticky toffees, which will just stick like eclairs, which will just go and get stuck in your teeth and just sit there, and the child's not brushed and it's just sitting there. So these kind of things are the worst things. So a nice little bit of a chocolate is okay, but just make sure you've had it after a meal. And after that, if you can have a quick rinse or a brush or a mouthwash after that, that's fine. But limit it to meal times and don't constantly snack. Don't constantly snack. If you have to snack, In between, try a healthy snack like a cucumber or a carrot or something like an
That
apple.
will eventually wash away, I think, clean the teeth also.
Yeah,
Like the abrasive action of carrot or any roughage that you eat is going to clean your teeth off with any kind of a sticky food or sweet or something which whatever is sticking to your
yeah,
teeth and is good for health also.
yeah, yeah.
Has
And
no
just
adver-
but ये इंडिया में कुल्ला करने का जो वो है, that is excellent. That should be maintained. So you don't need mouthwash. Just water is fine as well.
True. So thank you so much because you've been keeping busy. I know, and like UK timings are different from Indian timings, and then coordinating your UK time with my India time, and after whole days of work, you have taken time out for this interview, specially so that we can spread a positive message to the children and their parents who are associated with us as well as adults, so that on at least on World Oral Health Day we can strive to do a little bit more so that we have to visit the dentist a little less often, except for the regular medical checkups. You are a dentist and I'm saying I don't want to visit a dentist. So we can take care of our teeth and then, go for regular checkups. And I think you've covered up most of the points over here. So to all my people, I would just like to say ki, follow what she has told you, and what she tells you is as per the international standards. So there's nothing what I am telling you. So thank you so much for being here. I would say today morning, uh, our morning, your evening. So thank you so much, Dr. Parna Vasudeva, and
Thank you for inviting me. And I will again say one last thing to all the parents who are watching. Whatever habits you're forming for the children right now, that will stay for life. So, you might, if you don't make them brush, or if you're not yourself brushing twice daily, the children will not follow that, and that is in your hands, and you are shaping their future. So but if you make them brush twice daily now, and that they are going to do throughout their life.
they
So
will teach their children also.
exactly, so you are really, it's in your hands now.
Thank you so much
You're
for
welcome.
spending time. Okay, we'll take your leave now. Thank you.
I think me. Bye bye.
Bye bye. So that was Dr. Aparna Nath Vasudeva for you from London all the way. And I'm sure whatever she has told you will be helping you a great deal in maintaining your own oral hygiene as well as the oral hygiene for your children and thereafter. सो अगर आपको कुछ पूछना है तो आप हमारे को लिख के पूछ सकते हैं कमेंट सेक्शन में. एंड इफ यू हैव लाइक्ड व्हाट वी हैव मैसेज वी हैव कन्वेड, देन प्लीज डू शेयर दिस विद एवरीबडी. आप इसको इतना शेयर करिए कि सिर्फ आप नहीं, वर्ल्ड ओरल हेल्थ डे है. लेट अस ट्राई टू कवर मैक्सिमम पीपल एंड स्प्रेड दिस मैसेज एवरीवेयर. So, with that, I will just close today's session. Thank you so much for being with us. Tata.